Good morning, everyone, and welcome to the information session on pulse checks. We will have Colin Brewer presenting today from the Global Fund. We ask you to please put your questions in the chat. We will be responding throughout the session, but we will also have time at the end of the session to raise hands or still put your questions in the chat, and we will respond then. If we don't have all the answers to your questions, we will take your email addresses and respond by email afterwards. And with that, I pass on to Colin to start the session. Thank you.
Thank you, Marcella. Good morning, everyone, or good afternoon to those of you who are already in the afternoon. My name is Colin Brewer. I'm working in the operational efficiency team, which is a team which supports grant management, all the different country teams in how we manage our business processes that both country teams as well as PRs and LFAs and others go through throughout the grant lifecycle. So the session today is about a new tool we're going to be using to gather information about our grants called the Pulse Check, and I'm going to walk you through it. Next slide, please. So here's the agenda for today. First, we're going to talk about what the Pulse Check is. Then we're going to talk about what PRs will need to report through the Pulse Checks. Then we're going to explain how we're going to do this in the system. So I think many of you are familiar with our partner portal, which is where you go to update your contacts, your grant contacts. We've expanded that now to be able to report, and we'll explain how that's going to work. We're also going to tell you about how we will be providing support to you throughout this process. And then we will ask you to take a survey. I think the survey is about the quality of the training, if I'm not mistaken, Marcella. Marcella?
Sorry, Colin, say it again?
No, I'm just wondering, the survey is about the presentation, correct?
No, sorry, the external satisfaction survey, it's actually a survey we shared with PRs last week, and it's
okay,
about,
so it's just a reminder.
It's a reminder of the satisfaction survey for 2021 on Global Fund processes and procedures. So it's just we'll just ask PRs to respond if they have time, because the deadline has been extended.
Thank you for that clarification. And then, as Marcella said, we'll have time for questions. So my colleagues from the communications team who are facilitating would be happy to put your questions together. So please put those in the chat, and we will try and get to all of those at the end. If we don't get to all of them, then we'll make sure to provide answers in writing after the session. With that, please go to the next slide. So what are pulse checks? So just a little bit of context. We're looking to strengthen operational oversight to really try and improve performance and results for the people that we all serve as part of the Global Fund Partnership. And having more frequent data and more high quality data allows us to work with our PRs to identify and mitigate any bottlenecks, any risks to our programs. And so in order to do this, we are rolling out several complementary initiatives, some of which may come to you as PRs, some not, depending on your portfolio. And Pulse Checks is one of those initiatives. So we're really trying to put in more emphasis on timely and quality information, and also, trying to emphasize the accountability and responsibility for the ownership of data. Next slide, please. So as you can see here, here's some of the initiatives that are coming down the pipe, some of which have already started, some of which are starting now, and others which are forthcoming. And some of these relate specifically to C19RM, whereas others are kind of a combination of both C19RM, which is the COVID-19 response mechanism, alongside information about our sort of core grants, HIV, TB, malaria, and RSSH. So, there's two buckets there. The first is on PR reporting, which I think is most relevant to the group here, and you can see pulse checks in there. You will also see the streamlined PUDR, which is forthcoming for next year. So stay tuned for more updates about that in the coming weeks and months. The procurement progress updates, which I think many of you have already been providing on the COVID procurement process, and then the introduction of PR performance rating, which is something that will accompany the PUDR next year. You'll hear a lot more about that before it's rolled out. On the assurance side, supply chain spot checks are starting in 45 countries, and I think those of you who are part of that cohort will have heard about it. And then the usual additional assurance around COVID-19, whether it's through LFAs or others, based on risk, based on need, will continue to be ongoing. So again, all of this collectively will give us information about not just about COVID-19, but also the impacts of COVID-19 on our core grant programming. And I think given the additional funding that's been entrusted in the Global Fund and all of the Global Fund's partners, it's important that we continue to improve the available information and oversight that we have over these programs. Next slide, please. Great. So Pulse Checks. It's a quarterly tool that provides visibility into Global Fund investments for decision making. So starting now, next week, PRs for high impact and core portfolios will be required to submit the Pulse Checks. The first point is on, what do we hope to achieve through this? Well, we want to know more on a more timely basis, not just on the 6-month PUDR cycle, but on a more timely basis, how things are progressing as it relates to HIV, TB, malaria, and RSSH. And then, very urgently now with the huge investment in COVID-19 response, how are those investments going and how are they effectively mitigating disruptions based on or as a result of COVID-19? As part of that, using that information, we would like to, identify emerging risks and bottlenecks and be able to support our PRs in a more timely basis to mitigate those. So what is the Pulse Check? It's 3 sections. There's a first section, which is about the self-evaluation of implementation progress and disruption. The second section is around reporting selected coverage indicators. And then the third section is a few financial metrics. And we'll go through these in detail in just a moment. Next slide, please. I think we're conscious of the fact that this is an additional report. And it also includes some information which is similar to the information that we're already asking PRs to report through the PU and the PUDR. So we for the time being, we're going to launch this Pulse Check on a quarterly frequency. However, we are working on updating the PUDR and the PUDR process, as I mentioned before. And in doing so, we're going to make sure that we think hard about, the timing of these Pulse Checks, particularly as they relate to the submissions of the PUDRs and the PUs, because we don't want to have duplicative reporting at all possible, right? So we haven't reached a decision on this yet, is what I'm trying to say, but we're thinking about it, and we will be coming back with a kind of longer term approach, I would say, to balancing the Pulse Check and the PUDR as we move into 2022. But for the time being, you can expect that the first 2 to 3 Pulse Checks will come on a standard quarterly basis. In addition, there are 2 initiatives that have started since the beginning of the pandemic, which some of you may already be familiar with. So you can see there on the left, it says MECA indicator monitoring, but rather it should say COVID-19 indicator monitoring tool, I think is the external name. That is, for some of you, I think there was an initial cohort of 35 countries which were reporting selected indicators on a more regular basis. So we have taken that thinking and that approach and incorporated it now into the Pulse Check. So as we launch this new tool, that tool will be phased out likely towards the next 3 to 6 months. Similarly, we've had a COVID-19 monitoring tool completed by our local fund agents, and we in that tool they've been providing us with monthly updates on disruption due to COVID-19, and I know they've been in contact with many of you to be able to complete that. Asking them questions about disruptions to service delivery, disruptions to supply chain. And so some of those disruption questions will now be incorporated here in the Pulse Check. And as a result, going forward, we will discontinue that report that the LFAs have been completing. Next slide, please. Great. So just on this first pulse check, just a quick note on the timelines here. The PR information sessions are happening now. The first one here today, as well as the week next week. The pulse checks will start going out early next week, and you'll have a month to complete them. So this will be sort of standard timeline as we go forward with these first few iterations of this report. Like we said, we're trying to get timely information so that we can make timely decisions and really provide support where needed. We understand there's a lot of challenges that PRs are facing right now in the current context, and so be able to provide that support quickly. Submitting the information on time is really critical. So we really hope that PRs can make the effort to get these things on time, so that we can look at how things are going and support you wherever it's needed. Next slide, please. So I'm sure this is the part that you guys are all very interested to hear. What will you be reporting through the pulse checks? Next slide. So like I said before, there's 3 sections. The first one is on the self-evaluation by the PR, and how are things going in your HIV, TB, malaria modules? How are things going in your C19RM interventions? If you are a PR who is receiving funding for C19RM, are you coordinating with the national COVID response in an effective way? And then finally, are certain aspects of your program more or less disrupted by COVID-19? And I'll show you how this looks in just a moment. Like I said before, in terms of bringing in the indicator reporting that was already ongoing, we have a list of about 20 indicators across the 3 diseases, so HIV, TB, and malaria. And if one of those indicators is in your performance framework, you'll be asked to provide an update on the progress there in that second section. And then finally, a few figures on expenditure and forecast, both for your total grant funds as well as your C19RM funding. You'll note the asterisk there with the box on the top right. So, we understand that although all countries have received COVID-19 response mechanism allocations, in some cases that allocation is being split between several principal recipients, and in other cases, it's all going to a single principal recipient in the country. So if you're receiving COVID funding, then of course you would update on the C19RM interventions and the financial data related to that. If you're not, then you wouldn't have to report those sections. Next slide, please. Great. So I will walk you through in the system how this is going to look in just a minute, but just to kind of clarify, the different sections first, I think it's useful to just go through the screenshots quickly. So here you can see a screenshot from the Excel file, and you can see that in the first section of the self-evaluation, you have the modules in the grant, and then you have an option to select if it's on track, if it's off track with minor issues, if it's off track with major issues, or if things are particularly going in the wrong direction, the module is at risk. And we've provided a link there to some definitions by what we mean by that. In the case of this modules, it's really about, okay, are you on track to meet your targets in the next 6 months? And do you have any major bottlenecks identified that could prevent you from doing that? So that we've provided those definitions to guide you in selecting, sort of where you think you're at. Let me be clear here. This is to give us more timely data. This is not to replace the PUDR and the grant performance that we evaluate through the PUDR. I think that's a really important point to make. We're not going to be providing a grant rating based on this. This is for you to tell us where you think you're going to be facing challenges in the coming months so that we can provide support. It's not going to be used to say this grant has performed well or has not performed well. We still have the PUDR with its full validation of the comprehensive grant data. That has its purpose and will stay like that for the time being. For the pulse check, we really want to get a sense of how things are looking for the next 6 months. So rather than looking back like we do in the PUDR, we can look forward and try to anticipate some of the challenges and resolve them ahead of time. In addition to selecting that response, we'll ask for a short update. I think this is really just to provide some context and to the answer that was selected there. If you're saying there's major issues, what are those major issues? If you're saying the module is at risk, why is the module at risk? And again, this is not, we're trying to get away from just looking at things just from the indicator lens, and think holistically about financial absorption, supply chain issues, risk mitigation, et cetera. But the idea is that this is not a extensive report, right? We're calling it a pulse check for a reason. We hope that the responses can be kind of brief and to the point, and really just hitting on the key things that the Global Fund needs to know about challenges that you foresee in the coming periods. So with that, we can move to the next section, which is very similar. So here, next one, please. So here, very similar. If you have COVID-19 interventions as part of your grant, then again, deciding, are they on track, are they off track? And then providing us with a narrative update. I think here, to emphasize even further, unlike HIV, TB, and malaria, we currently don't have any progress indicators, any coverage indicators, impact outcome indicators as they relate to COVID. So this would be really critical information for us to know how this big investment in C19RM is performing, whether it's progressing or not, and be able to feed that back to the donors who have entrusted us with this additional funding. So, this piece, it's very similar. It's about understanding whether you feel like you're on track for these different interventions and providing an update. Next section. Great. So then in the cross-cutting section, we have a few questions. Well, we have one question, like I mentioned before, about collaboration with the COVID-19 response. So do you think the collaboration is going well? Agree or disagree? Again, this I think will apply primarily to those PRs who have COVID-19 funding in their grants. However, others may be collaborating in other ways. And then, like I said before, these disruption questions on the lower half of the screen were those which were previously being asked of the LFAs, and now will be asked directly of the PRs. So, are lab services disrupted? Is LMIS disrupted? Are your stock levels impacted, et cetera? And again, we've provided definitions for what we mean by the different rating scales there, whether it's high disruption, moderate disruption, et cetera. So that will hopefully guide you in responding to these. So that's it for the first section. We hope it won't be too much effort to complete, because we're really just asking for your sort of professional opinion on your own program, rather than say, asking for hard data like we do in the PUDR. Yeah, we think it'll be a very useful way to understand how things are looking for the coming 3 to 6 months. With that, we can move on to the second section. And whoever's not on mute, could you please mute? Yeah, thank you. Great, so then selected coverage indicators. So like I mentioned before, some of you may already be familiar with this approach through the COVID indicator monitoring tool, which you may already be reporting. So the idea here is that we're providing the best available data, right? Not a fully validated, data set like you do when you consolidate the data for the indicator reporting in the PUDR, but the best available data that you have at the time for a select number of indicators. So, like I said, there's a list of 20 indicators, which was available in the mock-up of the pulse check, which was shared with you previously and which we can share again. So that full list was in there. And if one or more of those indicators appears in your performance framework, then you will be asked through the pulse check to provide an update. And the idea is that we're doing this again on a quarterly basis, but depending on the indicator, we may be asking for a monthly periodicity or a quarterly periodicity. You'll note there that both of these indicators say number of. There's no targets for this period, right? We don't have a monthly target. You have a 6-monthly target. So we're not asking you to calculate a percentage. We're just asking you for the latest available data. So it's really the numerator of your indicator that you're going to be reporting here to say, okay, I've put this many people on ART, or I've, screened this many people for tuberculosis, rather than calculating a percentage. We're also asking to provide the, reports received versus reports expected, so that we could have a sense of, the completeness of this data as we use it as a guide to understand how the different programs are performing. I think I'll reiterate the point one more time. Again, this is not going to be used to calculate grant performance. This is an indicative data set that will help us to understand trends and also understand the impact of the COVID-19 pandemic on our core programming. So, just want to make that very, very clear. And also, again, it's the best available data. We're asking, a new frequency or a new periodicity, I guess we would say, for this data, which was not asked prior. So we understand that there may be challenges in reporting some of these indicators. And so we would just like PRs to provide the best available data so that we can have the best view on what is happening across our programs. Next slide. So then finally, finance. You can see here there's 3 sections. There's a section on the use of funds. Most of these, I think, if not all of these figures will be familiar to finance colleagues. They're very similar to those which we ask in the PUDR. So, payment for expenditures, disbursements to subrecipients, open advances, your closing cash balance, your open advances to SRs, and then, your forecast at a summary level for next quarter. So it's just a few numbers there, broken down by the total grant, and then within that, the C19RM funding. And this will help us to understand if this big investment we're making in C19RM is, being spent at a portfolio level, which is really, really important for us to be able to report to, our donors and others. So that's it. Those are the 3 sections of the pulse check. We have really tried to make it as narrow and specific as possible to avoid adding unnecessary reporting burden. We really hope that it shouldn't take very much time to complete. And with that, I think now I can go to the demo and show you exactly how this is going to work in the partner portal. So I think let me just make sure I have the screens open before I take over the presentation. So just give me one moment. Yep. Okay. Great. Oh, wait, excuse me, do we have process slides on the next slide? Maybe I should go through the process first before I go into the demo. Can we go to the next slide, please?
I think, Colin, you may have taken control. I don't know if Sylvia can move to the next slide.
Sorry, Sylvia, please go ahead. Uh-oh, I think we might have lost Sylvia. All right, let's see. Do we have the presentation? Does somebody else have it open? Maybe Marcella, you can share, or somebody, maybe Megan.
No, Nicole is putting it up.
Okay, thank you, Nicole. Thanks for your patience, everybody. Yeah, and while we're pulling it up, I think there's an exchange going on in the chat that jogged my memory here. So I've alluded to it, right? I've mentioned that this is not PUDR data, which I think is a very important point, right? It serves a different purpose. But in that, I think also there's the point around the detailed verification that would happen at a PUDR versus what's going to happen at a pulse check. So we are not going to submit every single pulse check for a complete verification by the LFA, right? Because we understand that it's just the best available data from the PR and not something that they have that has gone through their own PR validation process. So we won't have the same cycle of LFA validation that we do for the PUDR. That said, we may ask our LFAs, as we do for different pieces of information, to check certain things, but that will be on a kind of case-by-case basis rather than every single pulse check being looked at by the LFAs. Because again, we're trying to make this a timely process so that we can get quick information and adjust our approach quickly. Okay, with that, we have the slides back up. Thank you, Nicole. If you could go to the next slide, please. So we have, how should I say this? So I think everybody here is very familiar with receiving your PUDR template from your country team via email, completing it and sending it back to them, right? It's sort of the way we've done business for a very long time. We would like, as much as possible, to start moving away from that approach for several reasons. First of all, the templates are quite heavy. And as I'm sure you've gone through, whether it's in PUDRs or in grant making or grant revisions, please mute whoever's not on mute. Okay. So, you know, the templates are very extensive, and that's, you know, for good reason. We have a very, you know, complex grants that we need to fit into these templates, but it does present some challenges. And I think we would all, you know, appreciate if we could spend less time, you know, focusing on the templates themselves and more time focusing on the content. So our intent is to move towards a more direct reporting system. And what I mean by that is, if possible, for certain PRs to be able to go into a web form and just report directly in the web form, rather than always having to download this Excel file, fill it out, send it back, manage any technical issues that present themselves, et cetera. So with this pulse check, we are going to be bringing this kind of approach for the first time, right? So that means we're going to have two options, right? Everybody's going to go through the Global Fund Partner Portal. But for the time being, most of you will still download a template from the Partner Portal, and you will complete it, and then you will attach it back and you will submit it, which I will show you how to do in just a second. For, I think, about 10 PRs or 10 countries this first cycle, we're going to be piloting this other approach, which I just described, which is, you know, to have countries go in and report directly in the portal. And if we can show that that works very well, going forward, we will give everybody the option, right? Because we understand for some of you, it may still be preferable to have that Excel template, whether it's for connectivity reasons or to be able to discuss it with your SRs or whatever the case may be. But we want to give everybody who wants it the option to go in and just report directly in the system. So hopefully everything will go smoothly in this first pilot for these 10 countries, and we'll then be able to offer you that option starting in the next quarter. So with that, I will explain the process, and I'll explain it first for the Excel approach, which will apply to most of you here. And then I'll also mention the other approach in case there's anybody on the line who will be participating in that. And like I said, then I'll walk us through how it's going to work. Next slide, please. Okay, just quickly, I know you've received communications centrally and also follow-ups from your country team. In order to be able to do this, what I just described, going into the portal, accessing the template, sending it to the Global Fund, you need to establish who is going to be doing that from your organization. So we have made requests for you to provide 2 roles, or it could be, you know, at a minimum, a submitter role. The 2 roles are editor and submitter, and I'll explain quickly what those are. So we didn't want to tell PRs, you know, you should have your program manager doing this, you should have your M&E doing this, you should have your assistant doing this. We thought it would be more flexible for everyone if we said, okay, you can have a role of somebody who can go in, they can access the pulse check, they can complete the pulse check, they can attach the pulse check, but then you have another role, which is a slightly higher level of control, which then can click the Submit to Global Fund button. Right, so there's the distinction between those 2 roles. And if you haven't done so already, please provide that information through the link that was shared with you so that we can enable those people quickly and you'll be able to report your pulse checks as soon as possible. Next slide, please. Okay, so here's the process. At the start, we have the generate pulse check step. So of course, we will be doing the generation here at the Global Fund. We will be doing that through our system. And so when we click the send to PR button, it will send an email automatically to those people that I mentioned previously, the editor and the submitter that you have assigned. And I'll show you in a second how that will look. Through that email or directly by logging into the partner portal, you'll be able to access the pulse check. And there'll be a page for your pulse check. And for those of you who will be using the Excel form, you'll be able to download the Excel template. For those of you who will be entering it directly online, you'll be able to just enter your data directly there. If you have the template, you'll attach it back in and submit it to the Global Fund. Now, when we receive it, we'll take a look at it. We'll look at the completeness. We will reach out if there's need for clarifications. But again, this will be targeted. It won't be a full validation as we do for the PUDRs. So that at a high level is the process. And I think it would make more sense to you if I show you how it's going to work, given that that's what you're going to be looking at yourselves. So I think now I will take over the screen. Great. So you can see here, this is a testing inbox that we set up as we've been testing this approach. So imagine that this is your own inbox. And at the moment that the Global Fund sends to you the pulse check, you'll receive this email, right? That this is an automated message from the Global Fund Partner Portal. And in this case, I think we're talking about Myanmar. So, to access this pulse check for Myanmar, you can use the following link. So if I click on that link, it takes me to the partner portal. And I'm now landed on the pulse check for Myanmar TB UNOPS for the period July-September. Before I show you the template, I'll just point out a few things. So this is an English session, true, but just in case there's others who have different language preferences, at any time you can switch the language up here of the partner portal and all the different buttons and information, right? I'll go back to English. You can see the status here is not started. You can see that the reporting period or the report is due on the 31st of October. Because we followed the link, it took us right to the page of that specific pulse check. But if you click on pulse check up here, it will show you all of the pulse checks that you have available to you. Of course, we're doing the very first one. So right now there should only be one of these on your list, but this is a good just illustration of what we can expect in the future. So as you complete your pulse check, it'll move from status not started to in progress to submitted. And over time, you'll be able to go back and see here all the different pulse checks you've submitted previously, as well as any that you have coming up. With that, I'll click here to go back to my Myanmar TB example. Now, this is for the majority of you who will be doing this through a template. You can see that there are 3 buttons here: download, attach, and submit. So I'll go ahead and click download. Now it asks for a password. If you saw before on the page, just below the download button, there's a password. This is an extra security step, given how the system has been built. So you can just copy and paste that password in there. And it'll prompt me then to download. So now I can click download. Save that. And I can open it up. Great. So here we are, Myanmar TB. You can see the same information that you saw on the previous page about the grant and the component and the implementation period, as well as the pulse check reporting period. At the top, again, this is an English session, but should you need to, you can change the language to French or Spanish. And then you can see below the different sections which I walked you through before. So let's look at them now in the template itself. So here you can see the self-evaluation. You can see the different drop downs for the different modules, the space to provide the comments. The same, let me zoom in a bit, it's probably kind of small on your screen. You can see as well the interventions. So I think this is a good example of where the grant either has not been provided any C19RM funding, or perhaps you haven't finished incorporating that C19RM funding into the grant. So in that case, this table just shows the headers. It doesn't show any interventions, and that's fine. I mean, if you don't have it in your grant yet, or if you're not going to have it in your grant at all, then this table won't show any interventions. If you were to have interventions, they would show here, as I showed you in the screenshot before, and you'd be able to provide a response. The cross-cutting questions, like I mentioned before. Then you can see here the definitions. I won't go through these in detail now, but these were part of the mock-up that was shared previously, which we can share again afterwards, and you'll see them as well in your own pulse check when you receive it. The indicators, so in the case of Myanmar TB, they have 2 indicators that are part of the list, and you can see we've provided as a reference the PF information for the corresponding PF period. Again, this is just a reference. We're not going to be comparing the quarterly result against this for any type of performance calculation. It's just to kind of keep us all on the same page about which period we're talking about. And again, these are 2 quarterly indicators. I think most of the TB indicators are quarterly, but HIV and malaria, I think by and large are monthly. So that's the 2 indicators that this grant would be asked to report. And then the financial section. So what's my payment for expenditures at a grant level? Within that, what is my payment for expenditures for C19RM? And then down the line on these 6 or 7 metrics. As usual, we've provided free sheets similar to the PUDR in case you need to provide any kind of additional information that you feel is relevant. That's not required. I think the idea is that you just use this space for anything extra if needed, rather than try and change the standard standard fields which are locked. So that's the Excel. So now that I've completed that, I can close it. And back in the partner portal, oops, wrong one, excuse me. Back on the pulse check page, I can now attach the template, right? So if I click attach, it will ask me to add it. And I can see, where is it? There's my Myanmar one, right? So I can open that. So I can see here it says everything's happened successfully. And I can also see the file name below there. So you can be sure that the file that you meant to attach is the one that you attached, right? With that, if I'm comfortable to submit to the Global Fund, the person at my PR organization who's been assigned the submitter role should be able to click the submit button, so they can click submit. I think this is an important point. As I mentioned, particularly as it relates to the programmatic indicators, we understand that, in certain cases, maybe you don't have any reports for that month, right, for that particular indicator. And so you have a 0 value, right? We don't want you to stop that. We don't want that to stop you from submitting the pulse check. So we have enabled the ability to submit an incomplete file, right? That's not to say that we want you to submit an incomplete pulse check. Let me be clear. Of course, we would expect that PRs would complete to the best of their ability the pulse check. And I think as it relates to the self-evaluation questions and the financial data, there's no reason why the PRs should not be able to complete that in full. But we recognize that every country is going to have different challenges as it relates to programmatic indicators. Some may have no problem reporting them all every time. Others may have a lag or a particular month where it's difficult. So we've allowed for that incomplete submission to happen. So we're really asking for your best faith effort here to complete as much of the pulse check data, particularly the programmatic data, as possible. And when you have done so, you can then submit, even if one of your cells isn't completed, for example. Another reason we're putting this up is because we just want to make sure that you've put in correct values. And what I mean by correct is you're not putting any letters where there should be numbers, et cetera. So it's also just a reminder just to double check your pulse check before you submit it to the Global Fund to make sure everything's the way you intended it to be. And then when you're done, you can click continue to submit. And you can see the submit was successful and its status has changed to submitted. And that's it. That's the process for those of you who will be doing the template. When you've clicked submit, the country team will receive a notification. I think you will also receive a notification confirming that it's been sent, and the country team will be able to immediately access the data to review it and follow up in the event that it's needed. With that, I will show you quickly what it looks like for those of you who will be participating in the pilot. I don't know if we have anybody on the line who's doing that today, but it's a similar process. It's just that we don't access the template. So let me see if I can find one here. I think this Ukraine one is, yes, great. Okay, so for this HIV-TB grant in Ukraine, this doesn't mean that this grant is that Ukraine is necessarily going to be the pilot. Let me be clear. This is just an example grant. So if you're part of the pilot, you will be duly informed. So if Ukraine is on the line, don't worry. So Ukraine HIV-TB, instead of those buttons that we saw before where you could download and attach the template, instead you see the sections of the pulse check right here in the on the screen, right? And starting with the self-evaluation, you can see, similar to the Excel, the ability to select the options directly and provide comments. You can, again, if you have those interventions in your budget, then you would see those populated here for C19RM and the cross-cutting options. So no, moderate, high, very high disruption. Similarly, coverage indicators, you have the option to report those right here, and the data is provided, both the target for the PF as a reference as well as the information about that target. So very similar interface. It's just you're doing it directly in the partner portal. Can someone go on mute, please? Thank you. So yes, you can see the indicators there, and then financial reporting. Same fields, no different there. The only difference is instead of accessing the Excel file, you're just entering the information, and you're done. You'll note here that I don't have a submit button, and this is because I happen to be logged in as somebody who only has editor rights. So I think this is a good example of why we need to have a submitter for every PR, because this person here, who has been, for testing purposes, given permission to complete this pulse check, they can do everything that they need to do. For example, they can change this to strongly agree, but they cannot submit, right? So it will be the role of the submitter at your organization to, at the end of the process, come in and click submit. And for those people, the submit button will appear, similar to what I showed you in the previous example. You'll note that as I change things here, it tells me that it's been updated successfully. I think this is a very important point, especially given some contexts there's less connectivity. There's no need to click save, right? So as you're editing, you can be confident that when you're entering a comment or you're changing a status, each time that you do it, it's automatically recording that, so you won't lose your work, which I think is a relief to all of us, particularly when we're having internet connectivity issues. So that's it. Like I said, this will only be available to a few PRs this time, but we hope that if it's proven successful, we can offer everybody the opportunity to use this going forward. And looking even beyond that, if possible, bringing in some of this functionality to how we do our PUDRs. But that's still under discussion, sort of a sneak preview. Great. With that, I think the demo is complete, so I will give back the screen to my colleagues. We can put up the presentation again, please. Thanks. Can we go full screen? Cool. Next slide. So I won't go through these again. These are just screenshots of what I showed you in the demo. So I think it's a useful reference. I believe we'll be sharing these slides with you for reference. We will also be providing you with a detailed guide which explains kind of step-by-step everything that I just showed you on the screen. So rest assured that you'll have instructions. But as you can see from what I showed you, it's not very many steps. We hope it's relatively intuitive. So we expect that after you do it once, it shouldn't be too complex to do it. So we can just quickly skip through these screenshots, I think. We don't have to go over those again. Thank you. Great. So how will we be providing support? We understand that we're asking you to use this system to do something that you hadn't previously done, right? So whether you're facing system issues, maybe something isn't behaving as you expected it to behave, or maybe you can't access the system using the login that was provided, or maybe you have a question about the content of the pulse check that you're being asked to complete. All questions should be directed to this email address, countrysupport@theglobalfund.org. So we have a joint team from the IT side as well as the business side who will be looking at all those emails. They'll either be responding directly to you if they're able, or they're going to be coordinating both with your country team or with other teams in the Global Fund to make sure we get you the right answer as quickly as possible. So all questions should be directed to this inbox. It's going to be, the email address is going to be included in the notification email that you receive, letting you know that your pulse check is available. So you'll have it there, and at any time you can send this. We have agreed with our IT colleagues that support staff will be monitoring this inbox across the various time zones in which we work. So whether you're in the sort of Europe, Africa set time zones, or you're further ahead in Eastern Europe or Asia, or in Latin America, somebody will be looking at that mailbox during business hours, and then depending on the issue, we'll be getting back to you very soon to be able to tell you what you can expect in terms of a solution. Other resources on the website, we've been compiling all the communications we've sent you thus far. You can also see the mock-ups of the pulse checks if you want to go look now and look at the full list of indicators that I mentioned previously and see which of those you'd be expected to report. And then we're going to be providing that detailed manual in the coming days so that you have it available once we start sending these to you. Finally, there's an additional session. If any of your colleagues want to attend a further session on the 6th, we will have subsequent sessions in Spanish. I think there's only one subsequent sessions in French, and I think there's only one Spanish-speaking PR, so we'll be engaging with them directly. And then, we will make these recordings available at that same link so that you can go back and watch this again if you need to refresh your memory on anything that I said, or if you want to share it with other colleagues who would be interested who are not able to attend the sessions. Next slide, please. Great. So this is just a reminder, as Marcella mentioned at the top, we sent a satisfaction survey to all PRs, and we would really, really appreciate if you could complete this survey. We ask you to do many things as the Global Fund, and we want to make sure that, to the extent that we can, we are accommodating, your perspective and adapting to challenges that you have flagged to us. I know it's not always possible, but wherever possible, we would really like to adapt. And so, that feedback from such a survey is critical to that process, especially as we go through these kind of longer-term redesigns of things like the PUDR. Having that PR perspective is really invaluable. So if you want, you can follow the link in this survey, or in this slide deck when it's shared with you. I think you've also received an email separately on this survey. And it's a short survey, less than 10 minutes to complete. So please, please, please complete this for us. We would greatly appreciate it. And I think with that, we are done with the presentation. So I think we can open it up to questions. Oh, Renia, yes, my colleague Renia from the monitoring and evaluation team would like to come in, please.
Thanks very much, Colin. I'm just aware there's a lot of information here, so I was wondering, could you either quickly run back through any immediate deadlines that we need to be aware of, or maybe put them in the chat so that people can keep those in mind? Thanks.
Good suggestion, Nicole. Or Sylvia, excuse me. Could you go back up to the timeline slide? I think it was towards the top of the deck where we had the deadlines. And we could put that up on screen while we take other questions. Marcella, do we already have the questions in the deck, or are we just going to go moderated?
Yes, thanks, Colin. We have a few questions in the deck.
Okay.
And we
Next
can go
one,
through
Sylvia.
those, and people can raise hands if they prefer to speak.
Okay, great. So just quickly on Renia's point, to remind everyone, we're sending these to you starting next week. We have about 200 grants, so we will be doing it sort of incrementally. So you may receive it first thing Monday morning, you may receive it Monday afternoon, or a day or two later. So at the start of next week, you will receive your pulse check, and then you'll have until the 5th of November, more or less a month to complete it. So yeah, so great. So let's, with that, go down to the questions, please. And I will start with those that have been put in the chat, and then I see some hands raised as well. Yes, so if the answer is agree or strongly agree, will there be any need for comments? Good question. I think this is on the question about the COVID satisfaction survey, or excuse me, this is on the question about collaboration with the COVID-19 body. I think if you're agree or strongly agree, not necessarily, but really this is to provide us with insight so that we can support where needed. So as relevant, providing some context for why you think it's going well helps us to understand. Just selecting agree and then leaving it blank, it's not as valuable for us as if you maybe say that you're meeting with them quarterly, or you're part of a working group that it's something just to give us a sense of why you think it's agree or strongly agree. Brinia, yes, reiterating the point that the values to be reported here are numbers and not percentage. And then Abiodun says, assuming inputting data that are not to be validated will not be a challenge. I think I understand you mean that this is not validated from the PR side. Maybe Abiodun, do you want to come in and explain what you mean there? If you're still on the line.
Hi, Colin. Can you hear me?
Yes, please go ahead.
All right, great. So I was trying to the PR side. Because again, we're looking at couple of, I think about 15 days before the end of the reporting period, and at that time, the data might not have been validated from the PR side. So if it's submitted alongside the pulse check, there's every possibility that there might be maybe some adjustment that has to be made, a couple of days or weeks after that initial submission. So will that have an issue with respect to maybe the decision that the Global Fund wants to make from the data that has been submitted? And also, if I already submitted a pulse check and there's an update for a particular indicator, maybe there's additional information, like an opportunity for the PR to resubmit.
Great.
Over.
I think it's clear now. Thank you. So I think, as I mentioned before, we understand that depending on the context of your country and your own, both the national reporting approach as well as the PR's reporting approach, you may have all the data available at the time which the pulse check is due. You may have some of the data available, right? And we are asking you as the PRs to report the best available data. We don't want to delay the submission of the pulse check because there's delays in receiving the programmatic data. We want, the data that's available at the time that the pulse check is submitted. On the second point about updating, it's a really good point. Our colleagues in MECA, so Renia and her colleagues, who really spearheaded this effort and did a lot of great work, which we're now bringing into this project, In the MECA or the COVID-19 indicator reporting that some of you may already be doing, you are provided with the opportunity to go back and adjust the previous quarter. So you can report the latest quarter, but if you've received updated information for the previous quarter, you can do that. We intend to bring that into the Pulse Check. It was not something that we were able to do for this first launch because of really tight timelines. As you can imagine, with COVID-19, everything's moving very quickly. So for now, you'll just be asked to report this first quarter, but we hope that for the second or maybe the third iteration of this Pulse Check, you'll be able to, as you said, Abiodun, go back and adjust if you have an updated figure from the previous quarter. Next question, we can assume the indicators and frequency will be the same as what we're reporting. Yes, these will be the same. What will be the period? It'll be aligned with the grant PF. Good question. So as I showed you before in the screen that I was showing in the Excel and in the portal, you have the reference PF period, right? So let's take the current period that we're in. So July, December 2021. That's 2 quarters, right? It's the July-September quarter and it's the October-December quarter. So you basically have 2 pulse checks which are associated with that reporting period. But again, it's for the time being, it's purely a reference. We're not asking, this data to, the intent is not to say this is the reporting for this period, but rather, this is the pulse check. It's the best available data. It's telling us what's happening right now. And then the validation of the reporting period will become as part of the PUDR when you've had time to properly analyze and cleanse your data for the formal submission next year. I hope that is clear. Will there be any resource documents? Yes, as mentioned, there will be a guide for the process. There is the mock-up, which has been previously shared, where you can see the pulse check that we've just walked through. And for the specific responses on the self-evaluation, we've provided that definitions tab, which explains kind of the guidance about how we would expect PRs to respond based on the situation in country. Next slide, please. Is it correct to state that aside from the pilot countries, the rest of the PRs will still use this in addition to the PUDR? Yes, I think even for the pilot countries. So the point of this tool is to really provide not just the country team, but with the Global Fund as an institution with a sense of how things are going. So rather than waiting until the PUDR is validated, which is like 3 to 4 months after the end of the reporting period, to quickly understand on a quarter-to-quarter basis, are things going in the right direction, and to be able to provide better support to PRs. We're already reaching the end of year 1 of the new implementation cycle, and we've been awarded all this additional funding for C19RM, and the clock is ticking. And we want to make sure that as PRs, you're facing not just the normal grant challenges, you're facing COVID challenges. We want to be able to help you as much as we can. So we hope that by getting this information, we can then respond as well more quickly and get support where it's needed. Next question, who do we contact? Questions related to content. We're not asking, let's see. In this case, we have MDR-TB. We have 4 indicators for MDR-TB. So I think it's, like I said, it's a self-evaluation, right? So it's not an exact science. We've provided a guidance in terms of the definitions about what we mean by on track and off track. Essentially, what we're trying to do is say, you think you're going to meet your targets? Yes or no? Do you have major issues? Yes or no? Looking at those 2 pieces of information together and saying, okay, I think I'm on track, but I have some issues, or excuse me, I think I'm off track, but my issues are minor, or I'm off track, but I have some major bottlenecks. But it's going to be, this is the first time we're asking PRs to answer this question. And so I think as we all go through it together, we're going to find that maybe the way we answer the questions now in the first iteration might be a bit different than how we do it in a couple more pulse checks down the line, because we've sort of had some time to digest and appreciate the way of reporting. So we're asking you to do your best effort, your professional judgment based on the definitions that have been provided. When do we also know who will use the Excel sheet and who will use the OnPlan platform? Good question. Those PRs who have been selected for the pilot should hear towards the end of the week or early next. let me put it this way. Before you receive your pulse check, we will inform you whether or not you are part of this pilot. And then for everyone else, if everything goes well with the pilot, you'll be hearing from us in November to say, would you like to use the online portal versus using the template? May we know how we should fill for regional grants? Yes. So for RAI, we have taken special note of RAI. So the template will populate correctly with the countries that are part of RAI. So your case management indicator will come for each country, et cetera. And I believe you have a custom indicator, which we've also managed to get in there. So, you know, hoping that everything will go smoothly. I tested this one when we were testing it and it looked okay. So I think everything should be set for RAI. Is the pulse check different from the supply chain reports? Yes. So I think that health and supply chain reports, maybe George, which ones are you referring to specifically? Are you referring to the procurement update on a monthly basis, or are you talking about the supply chain spot checks? George, if you're still there, please come in and. Okay, maybe we lost George. I'll keep going. Oh, yeah, go ahead.
Yeah, I think we have new monthly procurement. I think supply chain reports.
Exactly. Yeah. So on the top, we showed you kind of how, you know, this is one of several things. There was a very, very urgent need for that data to come in sooner than we could wait to roll out this pulse check. So we went ahead and launched that report. I think ideally we could have brought it in here. Part of our intent with this pulse check was to consolidate as much as possible the things that we were asking PRs to report, so you're not receiving, you know, requests from different teams on different frequencies. But, you know, given how critical the procurement pipeline is for this COVID funding, we needed to move quickly with that piece. So unfortunately, we have those two things, the monthly procurement update and the pulse check. That said, if the procurement update is going to continue longer term, we will explore whether we can bring that in here to avoid you having to do two different things. So yeah, good point. We'll keep thinking about it going forward. Next slide, please. Lubna. Yes, hi Lubna. Nice to see you on the line. Yes, so for countries which are not able to access the partner portal, we will be sharing the Excel directly. So we've definitely considered this, and rest assured that you'll be receiving your pulse check, you know, in a timely manner, and we'll have instructions on how to submit it, which will likely be sending it back to the country team. So thank you for that point. Rati, where or what is the role of the vendor? Yes. Okay, thank you, Marcella. I think that's for a separate check for the health services spot check. Tongfit, so can we print or download the information? Yes, good point. For the majority of you, you'll have the Excel file, right? Because for the time being, majority of PRs will be using the Excel. So you'll have the Excel and you can print the Excel as needed. In terms of being able to print what's in the partner portal, in the interest of time, that's not something we enabled as like a function for the time being because we had to prioritize, but it's something that I've been very keen on getting because I know it's really important to have that kind of in hand, especially when you go to meetings where you're offline, et cetera. So for the time being, for those pilot PRs, you can probably print the browser screen, which I know is not the ideal scenario, but rest assured that we will be bringing this in as soon as possible, so you can have that ability to extract a PDF or what have you. So Arnell, for programmatic accomplishments, we are able to report the quarterly accomplishments. However, if the number of reports pertains to month, does this mean the number of reports received in the last month of a particular quarter? I'm not sure I fully understand. If you're still on the line, could you come off mute and explain?
Good evening from the Philippines. My question actually is that part where we are going to report the quarterly project accomplishments. And I think there was a row there where we have to also report the number of reports received so that we can check for the completeness of the reports. So I think that was referring to a monthly report in terms of completeness, but the indicators are quarterly.
Thank you. I think that clarifies. So let me just see if I can pull up the template, and I'll give it a go. And then Renia, if you're still on the line, please correct me if I misspeak. Actually, I think we have it in the sheet. Can we go back up to the snapshots of the Excel file, Sylvia? I think it's around slide 10, 12, around there, maybe. A little bit further. Yeah, go down. 2 more slides. No, stop there. The programmatic one more up, sorry. Great. So you can see here, this is a good example because we have a malaria indicator. This is a combined grant, right? So it's malaria and TB together. So we have a malaria indicator. The malaria indicator, we're asking for monthly periodicity, right? So to answer your question, Arnil, for those malaria indicators, or those indicators generally where we're asking for that monthly periodicity, we're also asking for the monthly reports expected versus received. If you compare that then to the TB indicator, we're only asking for the quarterly data, so the quarterly result. And in that case, then we're only asking for the reports expected and reports received for that quarter. I do realize now, though, that it says month there, so that's a good catch. I think we'll see if we can fix that over on the left for those quarterly indicators. But yeah, I hope that clarifies. But do come off and tell me if it's not yet clear.
All clear, thank you.
Okay, great. Marcel, or excuse me, not Marcella. Renia, did I miss anything that you want to add there?
No, that's very clear. Thank you.
Okay, great. Back to the questions. Okay, Tin. So I think I mentioned this point on RAI already. So I think that's a repeat. Or no, wait.
No, I think we're in the next slide.
Yeah, next slide, please, Sylvia. Great.
Jackson.
Jackson.
We're in 14.
So pulse check for supply chain reports. Jackson, are you referring to the supply chain spot check? I'm not sure how I don't see the link with the supply chain systems and the pulse check. So maybe you can clarify that point, please. Jackson, are you still there? Okay, I think Jackson may have dropped, so we will follow up with him. Next slide, please. Yeah.
Colin, just to note that we have 5 minutes and we still have one hand up. I think we responded to all the rest of the hands up apparently.
Okay.
But,
okay.
There's
Michael,
actually two more slides of questions.
That's fine. Why don't we take Michael's question then, please? Michael, go ahead.
I put it in the chat box. So one issue I'd raised is, can you increase the number of editors for the portal submission? Reason being, information is coming from different sources within the organization, finance and programmatic, and usually these sources would want to enter this information themselves on the portal. And then the submitter, of course, can review and submit. That was my first point. Second point was that I'm assuming that for the pulse check, we are only submitting this twice in the year. We are not submitting the pulse check when submitting the PUDR. Please confirm that. I submit.
Thank you, Michael. Good questions. So let me see. Is Usman on the line? Let me see here. I don't believe he is. Okay. I understand that we can have more than one editor, but I would need to be doubly sure of that before I say yes. So I will confirm that with my finance colleagues who are managing the contacts process. But what you're saying makes total sense, and that's part of the reason why we kind of wanted to leave these general roles rather than try and assign specific roles to specific people in your organization. So thank you for raising that point. We will get back to you on that with more certainty. On the point about with the PUDRs, could we go back to that slide, please, Sylvia? The one that showed the arrows with the PUDRs. A little bit more. Yeah, there we go. Great. So yes, it's definitely something we've been thinking about, Michael. We don't want to be asking for the same information at the same time necessarily. But that said, like I mentioned before, in order for us as Global Fund to get the results of the PUDR, it takes 2 months for the PR to submit it. Then it takes an additional couple weeks for the LFA to review it, and then we review it. So it's like 3 to 4 months after the reporting period. So for that Q4 pulse check, meaning October through December, there's still value in us receiving kind of a narrower set of information more quickly, so that we can still, understand what's going on while we're still waiting to validate the PUDR. So that's one point, right? There is value in receiving that pulse check. That said, as we move forward, we're going to be coming back to you in a few months' time to introduce the sort of optimized PUDR. And as part of that PUDR work, one of the things that we need to think hard about is, are there opportunities between the pulse check and the PU or the PUDR to consolidate, to offset in terms of submission timelines, et cetera. So we're working on it, and we will come back to you specifically. But for the time being, like I said before, we should anticipate that at least for the first 2 to 3 pulse checks, they're going to be on a standard quarterly basis, and there may be some kind of overlap in timing with the PUDRs. So thank you for being patient with us. Like I said, we moved very quickly to get this pulse check out when we received the new C19RM money, and we're doing our best to try and integrate it into our processes in a way that makes the most sense for everyone. We have 1 more minute, so I can maybe go to 1 more question. We'll wrap it up. Okay, great. Gladys, could you please clarify how and when the PR will see feedback on the analysis? Yes, good question. So initially, we are using this sort of for an internal purpose, for the internal committee that will be that's kind of managing this additional investment that we've received. And so that's our kind of immediate need. That said, I think there's a lot of value in looking at this information over different quarters, right? So if you see the progress of the PR quarter to quarter, you see the trends, both in terms of the modules, the interventions, the disruptions, but also programmatic and financial. So it could be very nice for both the country team and for the PR and maybe for the CCM to have visibility on this pulse check information as it is reported over time. And that's something that we are really interested in exploring further. And we will, continue to explore it, and we will let you know. For the time being, I think you can expect to have, the information you submitted available, and then your country team will engage as needed on any pieces where they feel like, they require more information, or, they want to feedback something to you. But in terms of like providing a comprehensive analysis to PRs, that's not something that is expected in the very short term, probably more of a medium term expectation. With that, I think we're at time. So Marcella, should I stop there and we can then try to respond to the other questions in writing?
Yes, Colin, sure. I think we have quite a few questions, though, and there's still lots of people on the line. If you want to do a couple of more questions, or we can ask people to put in their chat if their question wasn't answered, and we can send the response by email. Because there's actually, we have around 10 questions or so that I think we haven't responded to.
Okay, well, I can go for another 15 minutes. So maybe whoever would like to stay on the line can stay if you have time, and I can try to get through as many as I can. And then, like Marcella said, if there's any which are unanswered, we will share.
If people need to leave, to leave, just leave the questions in the chat. That would be great.
Great. Okay, next question. Let me take a sip of water. Yes. How can PR share the reports in Pulse Check to CCM, or only dashboard that they can see? Great question. Again, this is something that for the Excel should be rather straightforward, because it's available For those doing the pilot and using it in the portal, yeah, I think what I'm taking away from this is that we need to provide you with instructions for the best way to produce a kind of offline file for those of you who are completing it in the portal. So I will take note of that. And if you are part of this pilot, we will give you instructions for how to do that. But rest assured that going forward, we're going to try to make that as easy as possible for you. So we receive programmatic monthly data from SRs on the 10th of the next month. Reza, I understand you mean like a month and 10 days, or immediately 10 days after the receipt, after the end of the month? If you're still there, Reza.
Good afternoon, and we receive monthly data. For example, we will receive monthly data of September on the 10th of October.
Yes,
from our end.
yes.
So
Yeah,
your
so-
deadline was 5th every month, right? So in
5th
that
November,
case-
5th of the following month. The following month. So you have
In
a
that
full
case-
month.
So in that case, for example, if we submit data, we can submit data for July, August, September, not
Exactly.
for
You'll
December.
submit
So
July,
one
August, September, and you'll submit it up until the beginning of November. So you'll have a full month to engage with your SRs, get whatever reports you have available, put it together and send it. So you have, hopefully that's sufficient time to get the best possible data for the preceding 3 months.
And every month we have 1 month short in our data, right? For example,
So-
if you want us to submit data, so we can submit data from July and August, but not for the September. We will get it on the 10th of October.
Yes, but then you'll still have an additional several weeks after the 10th of October to submit. So the deadline is actually November for the period July, September. Maybe we can go back to the slide one more time, just so this is really clear for everyone.
We would love to see the slides.
Yes,
Okay.
one more time, please, Sylvia, up at the top. There we go. Next one. Perfect. So you can see the yellow bar here. Starting next week, you will receive the pulse check. And this pulse check reporting period, as you can see in the bottom left, will cover the period of 1 July to 30 September. So that's the period you'll be expected to report. You will have an additional month to actually report that. So you'll have up until the 5th of November to click submit. So Reza, if you're receiving reports on the 10th of October, you'll still have 2 to 3 weeks additional time to put that information into the pulse check and then report. So there's basically a 1 month lag between when we're asking PRs to submit and the end of the period which we're asking them to report on. So we're trying to give you enough space to gather as much information as you have available, because we know that that, particularly in the case of the indicators, takes some time. So I hope that clarifies, but please tell me if something is not clear.
Yes, thank you very much for your explanation.
Great. Okay. Next question, please. I think we are. Oh, okay, so Tin said. Oh, sorry. Go ahead.
No, sorry, Colin. We had missed this slide, so.
Okay, we're going back. That's fine. Yes. Tin, Myanmar, we have 2 PRs. When we do the PUDRs, we combine the data, but for this pulse check, yes, they will be sent separately to the separate PRs. I understand they have a separate set of grant documents, right? They have a separate budget and a separate performance framework. If you're still there.
Yes, Colin.
Yes, great.
Yeah.
So then they would receive separate pulse checks. Miriam, as this is just being introduced, PRs will need some support. Yes. So as mentioned, there's this email, country support at theglobalfund.org, which is available in this slide deck and will also be available in the email that you receive telling you your pulse check is available. Please, excuse me, please send all your questions there. And depending on the question, it will be directed to the right person. This is really important for us to kind of use this central channel because it allows us to track the type of questions that PRs are asking or the type of issues you're facing And that will really help us to better understand where we need to, maybe provide additional guidance or fix any bug that might be evident in the system, et cetera. So, as much as possible, please use that central support box. Rest assured that when it's necessary, we will liaise with your respective country team if it's something we need the country team to weigh in on or to be informed of. But please use the central email to ask your questions.
Okay, thank you.
You're welcome. Next one, Nashon, do we review reports on a rolling basis, or is it done at the lapse of the deadline? So it's done at the time once the button is clicked submit. So the data won't be available to the country team until you click submit. So even for those of you who will be entering it directly in the system, don't worry, until you click submit, the country team or others won't have access to that data. It's only once you click submit that it's pushed to us. At that point, then we'll be looking at it. And then once everybody is submitted, we will bring it all together to do our kind of internal analysis. Yes, Leonora, what is the rationale of having a submitter and an editor? Won't this cause delays in submitting? I don't think so, and I'll explain. The rationale is really because we know that in some cases, PRs like to have that control. So PRs would prefer to have somebody who's able to do the kind of preparation while still retaining a final submit process or submit function for a specific individual. If you think about the PUDR, when I was on the country teams, there's many people working to complete the PUDR, but I would always receive the PUDR from the program manager. I wouldn't receive it from, say, the finance person. So we tried to kind of mimic that type of approach. That said, if you want to streamline the process, the person who has submitter rights has all the same rights as the editor. So if you prefer that just one person complete and submit it, that person with the submitter rights can go in and do everything in the system and also click submit. So it's not that they can't edit, it's just that we've distinguished that submit role just in case. Victoria, yes. Will the PR continue to provide the PUDR? Yes. For the time being, the PUDR will come in January as it normally does. As I explained earlier in response to other questions, we would like to rationalize the reporting done through the pulse check with the reporting done through the PUDR. It's going to take us a little bit longer to figure out the best way to do that, so please bear with us. But just to reiterate this point, because I think it's important, they really serve two different purposes, right? This is sort of to give us a ongoing sense of how things are, happening much more quickly than we get through a 6-monthly PUDR. Whereas the PUDR, we want to kind of stamp the performance with a full validation. So give the PR the opportunity to present everything validated, have the LFA do a thorough review and provide a grant rating and issue a disbursement decision. So there is a bit of a difference in approach, but we recognize that it's an additional report, and we will do our best to rationalize both the content and the process as we move forward. Next slide, please. Is there another slide? Maybe not.
Yes, there is one.
Oh, there it is. Okay. Gladys, I think I answered this one. I think I answered the second one. I answered Reza's question. So Leonora, another question. Yes, retrieving for correction. So once it's submitted, for the time being, we don't have a sort of like a built-in correction process. Again, we sort of, given the time we had to work with to develop this, we went for sort of the core functionality. And in terms of resubmitting or updating previously submitted data, that's not built in, right? So you can write to the support mailbox if following the submission, you think there's something majorly off with what you had just submitted. You can make that request and we can evaluate it on a case-by-case basis for the time being. But like I said before, going forward, particularly for the programmatic data, we want to be able to allow you to update in the next pulse check. So let's say you're reporting now for the July-September period, you click submit, and then at the end of the next quarter, you receive your second pulse check. For July-September, which is the first period, you realize now, okay, I have much better data. I've received way more reports and I'd like to update what I submitted previously. We want to make that work. We just need a little more time to build it. So you can expect that going forward. So you'll have that opportunity each quarter to go back and adjust. Just in terms of, correcting, again, this is not going to be used to evaluate performance. So I think we just need to kind of shift our mindset a little bit in terms of what we're providing here. We aren't going to come back and say, okay, your grant rating is lower because you didn't have as many reports as you expected to have in that month. This is an attempt from us to get the best available data from you in a structured manner so that we can have a sense of where our portfolio is going. So we really see it as like a communication channel rather than a report for evaluation. So I hope that gives you some peace of mind in terms of, maybe not always having the best number, particularly on the programmatic side. If, for a particular month, you're still confident submitting it saying, these reports are missing, but this is the best we have right now, because that's all we're asking you to do. For systems submitted, any copies available? I'm glad you guys are raising this point. I raised this point a lot with my IT colleagues, and I will now share all this feedback with them so that we can prioritize this functionality. But I recognize it's very important. For those who are going through the system, like I said, we'll provide you with some guidance on how you can print something out in the interim as we work to develop something more elegant in the future. Next slide, please. Yes, can we increase? I think I answered your question earlier, Michael, and then I answered the second question as well. Yeah, can we get the supply chain health services spot check guide too? Yeah, so the link that we provided to resources on the last slide of the slide deck, I believe it also has the information on the spot check, if I'm not mistaken, Marcella.
Yes, that's correct. And we also share more details through the operational update. So I share that link too to clarify the difference between the pulse checks and the spot checks.
Yeah. And just to say thank you for being patient, everyone. I know that there's a lot coming along with C19RM, and sometimes it's a bit confusing. So we appreciate you taking the time to attend these sessions and listen to us explain how these things are going to work, because it's all coming very fast, both for you and for us. So really appreciate you working through it with us. For Suyi, for online, can different submitters enter data and save or submit at different times? They can enter data simultaneously. But it's only one submit button, right? So the submit button applies to the whole pulse check. So first you would have everybody go in and complete their respective sections, but then at the end you would have one person who clicks submit. So as I showed in the demo, the saving is automatic. So as you make changes, it's automatically saved. And then one person would have to go in at the end and click submit. Next question, after uploading and submitting, how can we know our pulse? Is there any dashboard? Yes, so if I still have it open, so you can always go back to your pulse check. Let me see if I can get it open here. And I think we're now at 12:30, so we should probably wrap it up. Uh-oh. There we go. So as I showed you before in the partner portal, you'll see here all of your previous pulse checks. So you'll see when you first receive it, it'll be not started. Once you start entering data or you download the template, it'll move to in progress. And then after you submit it, it'll move to submitted. At any point, you can go back and you can look at the what you've previously submitted. So if it's online, it'll be visible right there. And for the Excel, you'll have the Excel file that you attached. So to answer your question, yes, you'll always have access to what you previously submitted. And with that, I think we're past time. Let me stop sharing. Should we call it here, Marcella? What do you think?
Yes, Colin. Yeah, we have 5 more questions. Maybe we can look at them quickly, and if not, we can respond to people by email. Sylvia,
Okay.
if you can put the last slide, because
if we
we
can
still
get through
have
them, then that would be great.
Thanks, Colin. We still have 120 something people on the line. It means people staying around to hear the questions. So it would be good if we Sylvia, we can't see slides. Maybe Nicole, you can try.
Yeah, sure. 1 second.
One of the questions, Colin, is can online completion of the template when comments be saved and stopped to be completed at a later time? This is from Ibrahim.
Yes, that is a very important point that I showed previously, but I can show again. Let's see here, if I have it open, I can just quickly show you how that. Yes, as you make changes to the portal online, it saves. So here, if I switch this field to off track, it will show me up here that it's updated successfully. So there's no need to click save ever. As you enter information or make changes, it is automatically saving on the go. So you can rest assured that even if your internet connection drops, the last changes you made will all be saved. Thanks. You can take it back now. Sorry. Next question. Maybe somebody can read it to me if we can't get the slide up.
Yeah, would you mind clarifying what Global Fund is expecting PRs to enter in the column of total grant funds? What should be included in the total grant funds? And that's from Mitsuaki Hirai.
Great, thank you, Mitsuaki. Yes, so total grant funds, I mean, if you think about what we ask you to provide when we say, what is the total grant expenditure? For example, in the, tab in the PUDR or whenever your country team asks you for an update on the grant finances, I mean, we mean the entirety against the entirety of the budget. So what is everything that has been spent as compared to the COVID-19 response mechanism, which is going to be a subset of that, right? So it's money that's coming into the same grant, but because it's coming from a different source and for a different purpose, we're trying to make that distinction. So we're saying, what's your total expenditure, for example, and then what's the C19RM expenditure within that? And that will give us a sense of how both the grant overall is performing financially, but also whether the C19RM money is being spent both at the grant level, but also at the level of the Global Fund. So I hope that clarifies. I don't think we have finance on the line with me, but if you have more specific questions, please put them in the chat now. Alternatively, there'll be guidance accompanying the pulse check to explain exactly what we mean there, but in those fields. Does this pulse check need any supporting documentation? No, we are not asking you to provide anything. If you think there's something that you want to share with your country team, I mean, that's fine. But as part of the core process, this is supposed to be quick and light. We recognize the data isn't the best available. It's not validated. We're not going to validate it in the same way we do for the PUDR. So we really just want, the best available information. Yes, the requirement for the confirmation letter. So the confirmation letter is no longer required. Apologies for any confusion. For the time being, submitting the names is sufficient. So you're not required to submit the letter alongside the names for now. So that's, yeah, great. And is that it, or do we have any more?
No, Colin, you did great. Thank you very much. There's lots of questions, and thank you so much to everyone for having stayed over. And we will share the recording and the presentation, and do not hesitate to leave your if you have further questions in the chat. I think that's it, Colin, if you want to close.
Yeah, no, I just wanted to say thank you, everyone. I see quite a few people attended, which I'm very grateful for. A lot of work has gone in on our side into making this as useful and easy to use as possible. And so we just, thank you very much for, coming along this COVID-19 response journey with us, and trying to get the best possible information so we can make the best decisions about, how our money is being spent and how these programs are being implemented. So thank you, everyone. And we look forward to reporting on the pulse checks very soon. Have a good rest of your day, or a nice evening for those of you further ahead. Bye-bye.
Bye.